Hey guys, okay, it's day 1, week 2 of doctoring, and it's going well. But today I actually have been trying to tune in with how I feel, and I feel a lot more overwhelmed today. And it's kind of weird because you would think you're feeling better, as the days go on. And I do feel fine. I feel like I'm doing a lot better with just medical records, and I love interacting with clients and all that. But I don't know. I just feel there's an added pressure, and so it's making me overwhelmed. And not saying that pressure's from anyone in my clinic, it's probably just from me, just being you have to do better, you have to know more. It's because it's I'm encouraged in my off time. If I'm not having my own appointments, I need to shadow other people's appointments, and if I'm not doing that, then doing studying drugs and all this stuff, or sometimes I'm being told to do multiple things at once, and it's just a busy clinic, which is awesome, but it's just I feel overwhelmed on what I'm really supposed to be doing. Or I think the thing I'm struggling with is sometimes I just need a second. I just a minute to just think about what I just saw in a case, or a drug dose or something new I'm learning. I just need a second. I'm someone that just needs a process for a minute. So it's not necessarily I'm not doing anything. I just need to just think about it, So I think I'm just overwhelmed today. It could be because the weekend I had was a fun weekend, because it's my boyfriend's birthday and stuff. But also was there's some sadness because I one of my best friends, her mom passed. So I just have been thinking of her, and it just it's sad, and I don't know. So it's just been an interesting weekend, but this is gonna be a good week. I just felt I want to be true to this vlog and update you guys throughout the journey of being a new grad, because we're all going to go through emotions like this. But all my appointments today have been awesome. I had a little doodle puppy, and I love that. I want to be the doodle doctor. But it was nothing with my appointments that were making me overwhelmed. I think it's just knowing what I'm supposed to be doing, but also making sure people don't think I'm not doing anything. It's just if I'm just kind of standing there, it's because I'm just thinking about what to do next, or thinking about just a drug, I said, or a case. So sometimes I'm just I need to digest. So yeah, I don't know, I'm just overwhelmed today. So, but it's gonna be good this afternoon, because right now I'm on my lunch break. Went to take my dog outside, and yeah, I'm about to go eat. And I think maybe I'm just hangry, who knows. But yeah. All right, today is Tuesday. It is technically my day off, but I love surgery, so I want to see more things. And today, Dr. Ada has some ortho. And what? Hold on, I'm making a video. But we're doing a cystotomy right now, and I want to show you guys the X-rays. Check that out. So, I actually don't think I've seen a cystotomy yet, so it's gonna be cool to watch. Because one day I'll be doing them. Woo! Out these stones. Crazy.
Hey, Dr. Adam here. So we're just finishing a male cystotomy. Right before this, we did a female cystotomy. So the biggest thing with cystotomy is, remember, the stones are the result of something, right? So most times, say it was a struvite stone, it's a result of they had an infection. The infection produced a high pH, that's why they got stones. Or in the case of calcium oxalate stones, they got it just based upon nutritional genetic components. Either way, when we do a cystotomy, we're moving stones. We want to send them out to identify what type of stone, so we can work with the owner to help prevent them. So in the case of struvite, you want to make sure you appropriately treated the infection. And a lot of times, even with the calcium oxalate, they have a secondary infection too. So we always grab a culture, and the culture is going to tell us what antibiotic to appropriately use. And then we also want to send it out, find out the stones, so we can determine what type of diet we're going to put these guys on. So long story short, just doing a cystotomy in itself is not the end. It's going to make them clinically better, but you can currently treat the UTI, get them on the appropriate diet, and these guys should feel better pretty damn quick.
Nice. All right, this one had little stones. So the last one had huge stones, but these were a little more difficult to get out, but still quick, efficient surgery, learned a lot. Like I told you guys, I'm loving that I actually came in on my day off because it's another opportunity to learn. So
you would have a layer under.
all right, guys, I'm here with one of our awesome externs who's been with us for the last 2 weeks. Introduce yourself to everyone.
Hi everybody, I'm Sharon. I go to Lincoln Memorial University and I'm originally from Chesapeake, Virginia, and I'm a rising third year right now.
Woo! So how has your experience been externing with us?
It's been really awesome. It's really nice to kind of take the information that I've learned and applied it and kind of ask questions so that I can see all the different kinds of medicines that people do and the different ways that they do, so I can see what I like and what I don't like
Exactly.
when I come out. Also the mentorship, of course, because Dr. Adam and their whole, and Dr. Dan and their whole team is just awesome with everything.
Awesome. Yeah, she's been a great help. From the vet perspective, she's a perfect example of what you should do as an extern. She helps out everyone. She follows. She's engaged. She's always there to pick up some slack, even though she doesn't even technically work here. So that's something I like that you do.
Thank you.
And I've noticed. So just when you're externing somewhere, I externed here when I was in 4th year. Just help out, ask questions. Just go with the flow to everyone. So hope you had a good time with us.
Thanks, I appreciate it.
All right, so it's week 2, day 2, I believe, yeah, because Monday I went in, Tuesday it was day off, but I did go in to watch some surgeries, and then today is like an actual real working day. So my second day of my second week. I just did an Instagram live with Dr. Adam, him reviewing kind of how I've been doing for this past 10 days. So if you haven't, well, I guess by the time you watch this, it's going to be gone, but I'll kind of like talk about some things we talked about there. But yeah, I look crazy. I'm tired. Half the reason I look crazy is because it's like torrential pouring down rain where I live. And then also I had like maybe 13, 14, maybe 15 or 16 appointments today. And worked I went in at like 7:30 in the morning and left at 7:30 p.m. So definitely tired, but learned a lot. It was a good day. Like Monday, I was feeling overwhelmed for really no reason. I didn't even have that many appointments, but today I was like really busy, felt like I had more responsibility, and also was handling it better. So I really liked that. I just felt more confident today, and I was kind of hyper too, so it was fun. And just the people I work with are super awesome and fun. So that's awesome, How many times can I say awesome? But yeah, what did I want to talk about actually? So something that Adam and I were talking about on the Instagram live was kind of what myths or what things I thought I would struggle with, and if I'm struggling with it now, or what things I thought were true or not true about working in the real world as a vet or just being a new grad. I think the first main 2 things I touched on were confidence. I just really felt like I would not be confident at all, going into these exam rooms, and that's true to an extent still. But I do feel confident just going in, talking to the owners, asking about their day, commenting on something they're wearing, whatever, just striking up a conversation. So I do feel good about that. One thing I didn't think I'd feel really great about was the medicine. So I said on the Instagram live, I I think vet school does, you know, the job it does, like what it should, of building our like foundation on medicine and like client communication kind of, and all that. Like it's the thing that builds the foundation. So it's like overwhelming because then you like leave vet school and you're like, I don't really know anything actually. I don't know anything. Especially if you're going into GP, because I don't know what other schools are like necessarily, but you know, when we're on rotations, we're in a specialty hospital. So we're like, when we're on ortho, we're looking at total hips and doing stuff that I wouldn't do as a GP in practice. So I think sometimes like the clinics in vet school aren't necessarily like helpful for the real world. I guess in an aspect, but then it also is because you're like talking to clients, you're learning how to do paperwork. You know, you are seeing some things you would see, or you're seeing how you should refer things to specialists. So that's, you know, a whole thing in itself. But I like am definitely feeling more confident medically, even though I haven't really had a lot of medicine cases. They, like I said, they've started me off with vaccines, but I have seen like some seizures, diarrhea, like ortho, but I always can ask them. So I do feel more confident, and it's literally just repetition, like seeing cases that are similar, and you're like, okay, I remember this patient, and this is kind of what I did for treatment. I could tailor it a little, stuff like that. So I think that's really good. It's funny too, because on the Instagram live, I was like saying, you know, how I'll have good days and bad days or whatever, and then like just I mentioned, sorry, my brain is literally, I think half these videos I'm saying my brain is like crap shooting or farting out or whatever. But I thought of something really funny after the Instagram live, because I mentioned to Adam, like, yeah, you're gonna say like weird things to clients. I didn't tell him this, but it's so funny. So Adam, I've done a good amount of shadowing him to see like how he like works a room, interacts with clients, like what works well, what doesn't work well. And something he does with some of his like clients that know him really well. He has like he just has like a go-to nickname. So he'll be like, oh, hey, Dum Dum, which is like, at first I was like, is that like, do clients get like weirded out by that? But like they like it, and it's funny. And so today in the exam room, I was like trying to do this like physical exam on this very nervous dog, and I was like, oh, come out from under the chair, Dingleberry. And I'm like, I literally called this woman's dog a Dingleberry, and you know, the way I recovered, it was like, you know, it's just so funny thinking about it now. You know, I kind of finally got the dog out of the chair, and it was like kind of like being mouthy because it was scared. And I was like, oh my gosh, like right after I said the Dingleberry thing, I was like, oh my gosh, I was like, do you guys brush his teeth? Like they are shining white, which they were. It was not a lie. Like the teeth were great. And they don't actually brush the dog's teeth, so it's amazing. But she was like more focused on me being like complimenting the teeth than calling her dog a Dingleberry. So yeah, that was probably like the weird thing of the day. Like some other weird things that have happened over the past 2 weeks. There's like it's literally always the male puppy visits. The puppy's like humping my leg, like just like really going at it. And like I'm having this conversation about training and like diet and stuff with the owner, like straight face, and I'm like, this is my life, you know, it's okay, don't be embarrassed. And meanwhile the dog's like going to town, and I'm like, in my head I'm like but yeah, there's like weird things that'll happen that are funny, but you just gotta roll with it because you can't say everything perfect all the time. So yeah, I feel like I had to share that story with you because it was super funny. But yeah, today I'm feeling super good. I feel like I like learned the computer a lot more. Sorry, my grammar is poor if you haven't noticed already, and I slur my words a lot and mumble, so sorry. But yeah, like I was saying, I feel more confident in working the computer system we have, and then also just like logistics and like the flow of things. Like at first I was like kind of embarrassed and like felt like bad being like, hey, do you guys mind drawing the blood? Because I'm like so in that student mode of like, I do the paperwork, I draw the blood, I put the stickers on things, I do this. But like not really, that's not like necessarily my role. I'm happy to to help do so. Like when the techs are busy like running around, because they always are, they're always doing so much, like I'm gonna drop my vaccines, I'm gonna, you know, do this and that, like I want to help when I can. So I just thought, you know, I'm just doing better overall. You know, you have your good and bad days. Monday I was just feeling weird. You know, today's Wednesday, and it was good. So tomorrow's a half day. I'm excited. Like, you know, see more cases in the morning and then have like the afternoon off, and I'm gonna finish some social media stuff and just kind of relax. So yeah. All right, back at it, having run at the dog park, and I'm gonna vlog about my day today. So Thursdays are my half day. Blessed. Today was a little different. It was those vaccine appointments that come in that actually turn into like a whole wellness and like kind of almost sick appointment sometimes. And it was a good experience to me, and I'm so grateful. My client was like awesome. But yeah, it challenged me to like think. One of her dogs had some back problems. The other dog, had thinning of the hair, change in the appetite, honestly, like PUPD. So, one dog was thinking like more hormonal stuff. The other dog was thinking more, potentially orthopedic, soft tissue. So it like caused me to, have to think two different ways. And I haven't really seen a lot of like sick appointments yet on my own, and not sick or even wellness. It's mostly been like vaccines. So that was good, and also the dogs came in for vaccines, and one had a history of like severe adverse reactions. And so, for those ones I had to, for both of them, I went ahead and, give them a Benadryl injection, and then a little steroid injection, so we could prevent that, because one like literally I guess previously had swollen face, ears, like actually really bad. And so the owner was, nervous for both of them. So I got to learn kind of like how to do those kind of protocols, which is cool. And then, and then I had another, appointment. It was a dog there for grooming, but us vets, while they're there, we can do like their wellness checks and stuff if it's all due. And that dog had some neuro issues. They thought it needed to be, sedated for its groom. I actually listened to it. I was like, yo, this thing has a heart murmur. And so then we went the whole route on that conversation with the owner. Turns out, we didn't have to sedate it. Actually, he was fine. But it was kind of weird because, I honestly have never diagnosed a heart murmur on my own. I never took a cardiology rotation at school. And, if the animals were already coming to us at school, we already knew it had a heart murmur. So it was like my first time I got to be like, whoa, Dr. Andrea, this doesn't sound right. Can you like confirm or deny? So yeah, she was like, yeah, this is a heart murmur. But yeah, I was like kind of proud because like I'm so bad at cardio, so bad. And I just don't feel too confident in the murmurs because I just haven't heard enough. So that was kind of cool. But the thing that was like the downfall for me today was, I really love the client I had with the two dogs that, had, the back issues and like maybe endocrine issues. But, I really like bonded with her and it was awesome. But, I found myself getting like talking way too much in the appointment. And the good thing was it's a half day, so I didn't have that many appointments. And so I was still kind of technically on track. But I was on track with like seeing my next clients. But my paperwork was backed up. So like yesterday I had 15, 16 appointments. And, before the next appointment, my paperwork is usually done. And all you vet students out there, the paperwork you're doing at school is nothing like the real world. So just let that be like the light at the end of the tunnel for you. But yeah, so, it was good because like then at the end of, at lunchtime today, I was done. And then my other mentor took me out to lunch and kind of checked in with me more like how I was doing. And, she had told, she even told me a couple days ago she was going to take a look at my medical records and see what I could improve on or what I'm doing well, not well. So we talked about a lot of things I wasn't doing well, and a lot of things I was doing well. And they weren't like things like I was like offended about. I even told her, I was like, I think I could probably, add more on certain parts, be more detailed. Like my goal was just like trying to get them done. And like, so it was great. She gave me her feedback. It's awesome. I really, really like her a lot. And she's cool because she's 2 years out from me. And there's another vet there who's 1 year out from me. So I get to see like the progression of like what this practice produces in their veterinarians. Like the mentor I went out with today, she, is doing some orthopedic procedures. She's learning business stuff because she wants to be a business owner. And like, that's why, she's doing stuff with me. Like she's my mentor, obviously. But, she has like a very important role as a medical director now. And that's really cool to see, like as a vet that's 2 years out, you can do that. So I really appreciated that. I really like her. She's super helpful. I probably asked her 300 questions today and I felt bad. And so yeah, that was good. But today overall, good day. I'm so glad. I'm gonna just probably chill out, finish my YouTube video from week 1 because, you know, life. #work. Gonna get an eyelash fill today. Blessed. One of my clients yesterday actually gave me a recommendation. So we're gonna get, oh my god, Ren's gonna attack me. We're gonna get that taken care of, and then hopefully you guys like start enjoying these vlogs. I don't know, it's just like I've never vlogged before. Yeah, so hopefully it's just not a waste of either of our time. But yeah, all right. I'm working this weekend, so we'll check in again. I love you like a love song, Rennie. I love you like a love song, Rennie. And I keep hitting repeat, repeat. Okay. Don't be mad, guys. I'm not like driving and videoing. I'm in the McDonald's drive-thru getting a coffee because it's Sunday. It's my last day of the week, of my second week of being a vet. And yeah, yesterday I worked Saturday too. Wow, my eyelashes are falling off. Make a wish. Can't tell you. Saturday was wild. It was me and 2 other doctors. And yeah, long story short, I first started off like had probably 4 appointments for Saturday. Many were vaccines, and then all of a sudden my schedule started filling up with sick appointments, like not like sick, but like there's technically counted as sick appointments. But it's a lot of allergies, a lot of like masses, and then I had a cat that just really wasn't doing well at all. Has hyperthyroidism. And yeah, I'm really hoping that cat's doing okay today. I'm gonna call the owner and see how everything's going. So yeah, it was wild. It was like the first time I was like, wow, like I feel even more so like a doctor, because I am a doctor, you know. So it was neat, and it was overwhelming, but my mentors were there every step of the way, even though they were super busy. Like they had 3 times the amount of appointments I had. But they were super helpful. So I don't know how people like new grads do it without good mentors. Like I'm like, oh my gosh. Because yeah, we know stuff, we really do, but just having that reassurance and like having people help build up your confidence is just gonna make you practice better medicine, and just gonna make the clients trust you more. So I'm like, how do other new grads do it? How do they do it without good mentorship? I don't know. I really don't.